Regular checkups are a key part of staying healthy and preventing disease. Even if you feel healthy in the moment, yet more than 1 in 4 Americans don't go to their annual checkups. This is according to a recent AFLAC survey, and actually 28% of Americans regularly skip annual physicals and checkups. Why? Well, because they feel healthy in the moment. Hi, I'm Dr. Liz Perry, and I make videos about health, wellness, and the quality of life because I believe that by using the best practices from around the world, we optimize healthy living. In a recent Kaiser Health tracking poll, it was found that 92% of Americans do believe that it is important to get an annual physical. The problem is that only 62% actually do. Medical disclosure, non-disclosure. This content is not intended to diagnose or to treat any mental, physical, or psychological disorders, and nothing contained in the content should be misconstrued as such. I would like to introduce you, however, to the importance of regular checkups, emphasizing how they play a crucial role in maintaining overall health and well-being. A complete physical, along with standard lab tests, should be done annually to ensure vital health and wellness. Early warning signs are far better to address than late-stage disease and medical problems. In an annual checkup, we often are able to identify health issues early on, such as heart disease, diabetes, inflammation, infection, and certain cancers. So it's always best to be made aware early on to optimize healthy living. This is key to preventative health and a long and vital life. Getting your annual physical and suitable lab tests are considered a quote-unquote best practice when it comes to preventative care. Regular checkups do indeed play a crucial role in maintaining overall health and well-being. Part of the challenge, so let's discuss the primary reasons people don't go to the doctor for their annual checkups. As Kaiser indicated earlier in their poll, 92% of Americans believe that it is important to do so and go to your annual checkup. So why then is it that only 68% actually show up? Well, be it time, cost, fear of bad news, or simply forgetfulness, we do need to make it a priority to go to the doctor and get our annual checkup on a regular basis. So if we don't get our annual checkup, what do the potential consequences look like? Let's talk about that. Be it undiagnosed health issues, increased healthcare costs, and down the line, even a fatality that may well have been prevented. So let me share with you an example of this. Heart disease is, in fact, the leading cause of death in the United States and worldwide, and men who miss checkups are more likely to develop it. Other conditions that are commonly missed or delayed in diagnosis include cancer, colorectal, lung, breast, and cervical cancers are common and lethal, and early detection can significantly improve survival. High cholesterol can lead to blood clots, heart attack, or stroke if left untreated. Vitamin B12 deficiency, this is a common deficiency and is often overlooked, but supplementation can help if levels are low. When you go to your annual checkup, this is generally when labs are done. Standard labs on your annual physical typically include a CBC and a CMP, and it is a good idea that you familiarize yourself with these labs so that you can monitor yourself as well as your doctor. Always get a copy of your labs and keep them in a file together so you can compare your own labs from year to year. After all, this is your life, and in the healthcare forum, it is a wise choice that you take accountability and not only go to your annual checkup regularly, but learn some of the basics of your lab tests. I will go over a few of these basics now. Number 1, CBC, which stands for Complete Blood Count. This is a blood test that shows the breakdown of both your red blood cells, your white blood cells, and your platelet count. Optimally, you want to have your red blood cells that are listed on your CBC report as RBC in the middle of the lab range. The same applies for your hemoglobin. You want to look at your CBC report and see if your RBC and hemoglobin, which are both part of the red blood cells, that are in the middle of the range. The middle of the range, not at the low end. If your RBC or hemoglobin are at the low end, either or, of the range on your CBC report, it can be a cause of your fatigue. Typically, your doctor will not bring this to your attention because technically you are in range. However, it can cause symptoms of fatigue, tingling sensations in our feet or fingers, so it is best to be in the mid-range on these 2 tests. Simply increasing consumption of grass-fed organic beef and asparagus can help build your red blood cells to optimal healthy levels. Number 2, CMP, which stands for Comprehensive Metabolic Panel. This is also a blood test, and it looks at the overall health of your kidneys and your liver, electrolytes, and momentary glucose levels. Everything should be in range here, and your eGFR should be above 60. eGFR provides an indication of our nephron health within the kidneys. We are all born with approximately 2 million nephrons, and we don't often have any symptoms until 70% of them are damaged. Nephrons within our kidney system are an important part of our blood filtration system, helping to keep our red blood cells clean and healthy. Eating organic kidney beans can be good for our kidneys. If glucose level is high, it is important to get an A1C3 lab test, which is a blood test providing us with a more accurate glucose reading. Number 3, a lipid panel. For this test, we generally fast prior to having this test. Lipid panel, which shows the breakdown of both the good cholesterol and the bad cholesterol, as well as triglycerides. If you have elevated total cholesterol, yet your cholesterol ratio is good and your triglycerides are in range, there is not need for concern as compared to elevated cholesterol, unhealthy cholesterol ratio, and elevated triglycerides. The lipid panel shows the cholesterol breakdown of both the good cholesterol and the bad cholesterol, the HDL and the LDL. The HDL is the good cholesterol, and the LDL, which is known as the bad cholesterol. We do need cholesterol to live. Cholesterol actually is a hormone. Cholesterol is not a fat, and cholesterol is absolutely necessary for human life. What is important is to have a healthy ratio of good and bad cholesterol in comparison with total cholesterol and triglycerides, which are our fats, within range. Triglycerides are also measured in this panel and measure the fats. We do not want to have elevated amounts of triglycerides found in our lipid panel of our blood work. If you do, try eating a more clean diet, incorporating more leafy greens, fresh organic vegetables, and fresh fruits into your daily diet, and work at eating less red meats, less dairy, and eliminate processed foods. Number 4 is the A1C3 lab test. The A1C3 is a blood test. A1C3 measures your blood glucose levels over a 90-day period. This is a more accurate determinant for detection of diabetes, specifically diabetes type 2, commonly referred to as diabetes mellitus. Number 5, vitamin D3 is another blood test recommended annually. Lots of research testing on vitamin D and how it is beneficial to our immune health, bone health, and our energy levels. It is important to have a healthy level of vitamin D in our blood. Vitamin B12 test. Vitamin B12 protects our nerves and our nervous system, and B vitamins in general can improve our mood. CRP number 7 lab test, which stands for C-reactive protein. This blood test can be useful as a general indication of heart health, inflammation, and cardiovascular well-being. If yours is elevated, you can choose to initiate heart-healthy eating by consuming more heart-healthy foods. You may choose to engage in exercise and spend more time daily with nature as well, all which are found to decrease inflammation and improve heart health. Number 8, if you are a female, it is important to get an annual pap smear from your OBGYN. It's easy to treat cervical dysplasia or even early stage cervical cancer. Not so easy to treat later stage cervical cancer, which can be fatal. So once again, let's prevent. I will share with you a key story about a middle-aged male patient that came in for his annual checkup. This individual was struggling with anxiety, gastrointestinal issues, as well as hypertension and hyperkalemia. He opted to incorporate best practices to optimize his healing, and he diligently followed a 4-month wellness program, which included complete physical checkup with the labs listed above, acupuncture, and herbal medications which were used to treat his anxiety and gastrointestinal issues, along with a statin to lower his cholesterol. He further committed to cleaner eating, drank celery juice twice daily, incorporating more fresh fruits and vegetables into his diet, less fried and spicy foods, and result, he is feeling well today and no longer has anxiety, GI problems, hypertension, or hyperkalemia. So to conclude, I would like to reinforce the importance of prioritizing annual checkups for long-term and optimal health and using best practices available from around the world to optimize your healing efforts. Call to action. Please give us a thumbs up and feel free to subscribe. I invite you to, if you enjoyed the video, and I invite and encourage you to share your own experiences of your checkups in the comments below, as well as suggest for you to watch any additional lifestyle videos to learn more about improving your health. Thanks for stopping by, and jusqu'à demain.